Hello everyone. Today, we're diving into the world of a medication called Paliperidone Palmitate, commonly known by its brand name, Invega Sustenna. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Paliperidone Palmitate, recognized by its brand name Invega Sustenna, is an antipsychotic medication that belongs to the atypical antipsychotics class. This long-acting injectable is primarily used to treat schizophrenia and schizoaffective disorder in adults. Administered once a month, it helps manage symptoms such as hallucinations, delusions, and mood swings by acting on certain neurotransmitters in the brain, particularly dopamine and serotonin. Initially approved by the FDA in 2009, Invega Sustenna offers a sustained release of medication, which can be beneficial for those who have difficulty adhering to daily oral medication regimens. It provides a steady dose of paliperidone, ensuring consistent therapeutic effects and potentially reducing the frequency of symptom relapse. Warnings: Paliperidone palmitate comes with several precautions. It's not recommended for use in elderly patients with dementia-related psychosis due to an increased risk of death. Additionally, there's a potential risk of neuroleptic malignant syndrome, NMS, a rare but serious condition characterized by muscle stiffness, fever, altered mental status, and autonomic dysfunction. Patients should be monitored for symptoms of NMS and other severe reactions. Before starting Invega Sustenna, patients should be evaluated for a history of cardiac issues, as the medication can cause changes in the heart's electrical activity, QT prolongation. Those with a history of seizures, low white blood cell counts, or other significant medical conditions should also discuss potential risks with their healthcare provider. Before taking this medicine. Before starting paliperidone palmitate, several factors need consideration. It's crucial to inform your healthcare provider if you're allergic to paliperidone or risperidone. Discuss any pre-existing medical conditions, especially heart problems, kidney or liver disease, diabetes, or a history of seizures. For women, it's important to inform your doctor if you're pregnant, planning a pregnancy, or breastfeeding, as the medication can have effects on the fetus or newborn. Regular monitoring of blood glucose levels is advised for those with diabetes or at risk of developing diabetes, as paliperidone can cause an increase in blood sugar levels. You should not take paliperidone palmitate if you have a known hypersensitivity to paliperidone or risperidone, or if you have severe kidney impairment, as the drug is primarily excreted through the kidneys. Side effects: like all medications, paliperidone palmitate can have side effects. Common side effects include injection site reactions, weight gain, headache, and restlessness. Some individuals might experience extrapyramidal symptoms, movement disorders, such as tremors, stiffness, and tardive dyskinesia, involuntary, repetitive body movements. Serious side effects can include increased risk of stroke in elderly patients with dementia-related psychosis, hyperglycemia, and diabetes. Additionally, there is a risk of orthostatic hypotension, a sudden drop in blood pressure upon standing, which can cause dizziness or fainting. Other potential side effects include increased prolactin levels, which can lead to menstrual irregularities, breast enlargement, or lactation in women, and breast enlargement or sexual dysfunction in men. It's essential to report any new or worsening symptoms to your healthcare provider promptly. Interactions: paliperidone palmitate might interact with other medications. It's crucial to inform your doctor about all medications, supplements, and herbal products you're currently taking. Particular attention should be given to medications that can prolong the QT interval, affect blood pressure, or alter blood sugar levels. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking paliperidone palmitate. The typical initial dose is a higher loading dose administered on day 1 and day 8, followed by maintenance doses given once a month. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The initial dose usually consists of 234 mg on day 1 and 156 mg on day 8, both administered into the deltoid muscle. After these loading doses, maintenance doses of 39 mg to 234 mg are given monthly, based on the patient's clinical response and tolerability. Avoid: while on paliperidone palmitate, it's advisable to avoid activities that require mental alertness, such as driving or operating heavy machinery, until you know how the medication affects you. Alcohol should be avoided as it can exacerbate certain side effects and potentially interact with the medication. FAQ: Many wonder about the age restrictions for paliperidone palmitate. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of paliperidone palmitate, known as Invega Sustenna. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.